You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
Of the rejuvenation procedures that we carry out, eyelid surgery is the one that provides more lasting results, meaning it would be rare that the same patient may need upper eyelid surgery twice. Can it be done? Absolutely. If there's a redundant skin, the answer is yes. If there's a depleted fat can be replaced. But it's unlikely. Most likely, that patient who had upper eyelid surgery and now has redundant skin is going to need a forehead lift rather than eyelid surgery. And the same for the lower eyelid. We can actually redo the lower eyelid surgery, either for correction of the previous surgery that did not result in an optimal outcome, or a patient who has developed fat pads that were removed, but sometimes they come back. But that would be, again, extremely unlikely. It is not like aging facelift that most patients would be a candidate for another operation. However, in either situation, a facelift or eyelid surgery, the rejuvenation, the changes that will occur is permanent, meaning if we make the patient's eyelids to look 10 years, 15 years younger, that patient is going to always look 10, 15 years younger, because we're not stopping the gravity, if we're not stopping the aging. Had we not done that surgery, that patient would have looked a lot worse. So the results, that change that we occur, are permanent. What we are not doing is stopping or halting the time element and gravity effect on the face or the eyelids. It is true about any plastic surgery procedure that if it is done properly and the patient heals properly, it should not be obvious that the patient had surgery. And the reason is we strive to create natural change on the eyelids or the face or the nose, or even on the body contouring. And because of that, it should not be obvious that the patient had an operation, no matter where the surgery is done, particularly the eyelids. On the other hand, if the eyelid surgery is not done properly, it doesn't heal properly, unfortunately, the reverse is true. The face will look different. And then the reason is when we look at people, first, we look at their eyes. That's the first thing that we see. And the changes that are drastic there that make the patient look different is going to be obvious to us immediately. So because of that, as I mentioned earlier, this is the most demanding and most precise surgery next to the nose operation. There are two procedures that are extremely demanding and require enormous experience. The nose operation, rhinoplasty, and blepharoplasty. As I indicated earlier, they're totally unforgiving. There's really no room for a minimal error. We have a number of patients who have allowed us to use their pictures in my website. However, we have more pictures in my office because some patients only allow us to show their pictures to the other patients in the office setting. And we respect the patient's privacy rights, and we do not ever show any pictures of patient to somebody else, even their friends or family members, without the patient consent. For a consultation about blepharoplasty, you can call my office, 440-461-7999. Again, 440-461-7999. Or go to our website, and that is Dr. Bahman Guyuron, one word, .com. And we'd be happy to offer in-person or virtual consultation overwhelming majority of my practice is from out of town, out of country patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.